Hi everyone, Alexandra here with MDPen. Thank you so much for tuning in for today's live video. Today we are on Facebook, LinkedIn Live, and YouTube. I have a very special guest today, our Educator, and we're talking about the top 5 questions that are commonly asked during an MDPen microneedling training. So some of the most common questions that we hear, they also happen for me too. I do the skincare trainings as the brand product specialist. So we kind of got together and put together these 5. If you have questions at any time during this video, feel free to use the comment to answer you. The first one we're going to talk about is how soon can my patient have direct sun exposure? Your opinion on this, Sydney?
So from an aesthetics standpoint, Alex and I talked about this a little bit earlier, but from an aesthetics standpoint, I would love to say very minimal to no sunlight or sun exposure, but I am smart enough to know that spring and summer are coming and people are going to be participating in vacations and outdoor activities. So for sure, the first 1 to 2 weeks, I would try to not have any sun exposure. You know, the skin is still going throughout its healing phase, and it's in that healing stage. So we don't really want to alter it. Also, we know microneedling can heighten sensitivity and make you a little bit more vulnerable. So it's super important to not have that direct sun exposure within the first 1 to 2 weeks of getting treated. Now, after that, after your 14-day mark, we always recommend have a nice, high quality, professional grade sunscreen, so a good SPF to actually protect the area. And if you are going on vacation or hiking or in an element that you know you're going to be very much so exposed, possibly a hat or some sunglasses or anything to really help kind of minimize that sun exposure on the treated area. So yes, I would say wait about 1 to 2 weeks, and then after that, add proper sun care SPF.
Completely agree. If someone's going to a theme park or some tropical vacation, you guys need to reschedule and make sure you have that 2-week out mark. Yes, physical sunscreen, wide brim hats are great, Tilly hats. But if someone tells you that, you know, their appointment's on Thursday and they're going to the beach on, you know, Saturday for a big family beach vacation, it's worth rescheduling. Even if you're losing, you know, that spot on your schedule, it's very important. Another question that's commonly asked is how much product will I use during the treatment? So people are kind of talking about our different serum bottles. And as far as using the glide during treatment, they want to know how long that bottle is going to last them, how many, you know, pumps of our Pure HA, cellular renewal, or Tighten and Lift can they expect to use during the treatment?
Okay, I love this question. I get this during trainings as well. I think it's important to kind of have an idea or a roundabout idea of what you're going to use once you're treating. So typically I like to say for full face treating traditional microneedling, you'll probably most likely use around 10 pumps of HA. So that's our hyaluronic acid. And then as we know, we can kind of add certain serums to kind of heighten our results for whatever situation you are correcting or enhancing. So if you were to add the human-derived growth factor gel or our cellular renewal serum, I would say for those the growth factor gel for sure, 2 to 3 pumps that you can add with your 10 pumps of HA, and then the cellular renewal I feel like anywhere between 3 and 6 pumps. It is a little bit thinner of a product, so in my opinion, it might be a little bit more than the growth factor, but yes. And then our copper HA mist, you know, you do want to use it twice during the procedure. So 4 to 5 spritz, the first to prep the skin in the beginning of the treatment, and then 4 to 5 spritz at the end to complete and conclude your treatment. So that is what I have gathered as far as what you can expect to utilize during a treatment. Alex, do you have anything to add as far as any other specifics they could expect?
Yeah, so with most of your MDPen opening orders, you guys should be receiving this professional back bar size of the HA. And you can expect to get at least 60 treatments out of this size bottle. That's why it's really important to have the professional size. You can expect to get at least 12 out of this 1 ounce size. But again, just so you're not constantly blowing through the retail bottle size, I do recommend getting this 4 ounce size. And if you guys love the Tighten and Lift and Cellular Renewal as much as Sydney and I do, you can always get that in the 4 ounce size as well. So it's nice to have 4 bottles in this size. You've got your HA Copper Mist in this size, your Tighten and Lift, your Cellular Renewal, and your HA. So you have everything you need to work with throughout the treatment. With most opening orders as well, you will receive the human-derived growth factor gel in this 3.4 ounce retail size. We do make it in a large 16 ounce pump that's, 5 times this size. But in this bottle, you can expect to get at least 50 applications if you're doing 2 pumps per patient. And when you're just treating the face, you're honestly not going to need 2 pumps, maybe like a pump to a pump and a half. So that's why I say at least 50 applications out of this bottle. So these are commonly asked questions during trainings for sure. And just skincare trainings in general, even, patients that are purchasing the 1 ounce bottle, they want to know, how long am I going to be able to use this? If you're using it AM and PM, 2 pumps AM, 2 pumps PM with your serum, you're going to get 30 days out of this 1 ounce size. So they are intended to be repurchased. And of course, if you're just using them for post-care that first, 3 days following treatment, then that's a different story for how long it's going to last. But hopefully that helps you guys. Again, feel free to ask questions at any time in your comment boxes, and we will be sure to check those out. How long will it take for my patient to see results? What should I tell them?
Yes, that is a good one, because when you are getting microneedling treatments, that's like the number one question and idea is, okay, I've done this procedure. Now, when am I going to see a difference in my skin? So I like to typically tell people within the first 1 to 3 days, as you are going through that healing process, you can expect some differences and changes and improvements in certain areas. But of course, that first week to 2 weeks, again, you're going to gradually see improvement in tone and texture of the skin. But as we know, our full cellular turnover rate is about 6 to 8 weeks. So that's about the time it takes for our skin cells to fully renew, regenerate, and give us that smooth, taut, firm outer layer. So typically I say full results within the next 6 to 8 weeks is when they'll really see that. So whenever they are coming back to see you for their second treatment, they should definitely see a difference at that point. Is there anything you want to add in comparison with that? Or is that about what you
Yeah,
experienced too, Alex?
that's it. Yeah. And it's better, of course, like I always say, to under promise. That
Yeah.
way, when your patient is seeing that nice, bright, smooth skin, even at 2 weeks, they're going to be like, oh, wow, she said there was nothing that was going to happen for 6 weeks. So typically after microneedling, a week or 2 later, you can look like almost like you've recovered from a peel. And you do see that brightness. Definitely the 6-week mark is when you're going to see more things happening with the collagen, like smaller pores, difference in your fine lines and whatnot. But the goal would be by the time they're coming in for their second treatment, they're starting to see something. So I completely agree with that one. Hi, Barbara. I see you in the chat. So your question is going to be actually our number 5 question. So we're going to get right to that. That one's so common. Our next question is going to be, how should I clean my pen and what should I be using?
Yes, this is a good one. So of course we know we're breaking the epidermis, so we do have to be extremely sanitary and just use optimal caution when cleaning and prepping and breaking down for this procedure. But so typically I like to wipe the entire pen and also the cord itself. I utilize these, it's kind of like a multi-purpose wipe, but basically it's going to be antiviral, antifungal, antibacterial, antibacterial. And so that way you just kind of cover everything across the board. But really making sure at the end of your treatment, we are discarding our needle cartridge in a sharps container and then utilizing those multifunctional wipes to actually wipe down the whole pen device, and then moving on again, like I said, all the way down to the cord, because as we're treating, sometimes stuff can overlap or possibly touch a product or a sleeve or the bed or whatnot. So just making sure all aspects of the device are fully cleansed. I know you could probably utilize a stronger high percentage alcohol. What is your take on that, Alex?
Yeah, I agree with you. It needs to kill everything. You don't have to use the brand, but of course, Cavicide, is a big one. That's always a safe choice. It typically comes in a spray bottle or a white bottle. And even if you have used a sleeve on your pen, as Sydney said, you've got to wipe the whole exterior of the pen down, and then that whole entire cord, which is typically about 6 feet with the cord. Chances are you've had it, braced near your arm or something like that. So even if you've had a sleeve on it, everything needs to be wiped down. As soon as your patient has left and you've, maybe walked them to the front desk and you go back in your room, the first thing you need to do to start that cleaning process is remove the needles. And this is a safety precaution. So you need to re-glove with clean gloves on, remove that needle cartridge, put it in your sharps container, and from there you can resume the rest of the cleaning process. But just for your own safety and anyone else's, I always say the first thing you should do is go ahead and remove that. Our pens should not be autoclaved by any means. Cleaning the exterior. Besides that, completely agree with you, Sydney, and that's all great advice. And yes, you've got to have, germicidal, something that kills everything. Our last question, which is what Barbara was getting to, is what is the recommended post-care for days 1 to 3?
Yes, that is extremely common. I feel like that's right up there with the result question. So they want to know how quickly they can see the results, but then also, what do I do after I have a microneedling procedure? How do I treat the skin? So basically, when you are talking on how this person or how your client is going to feel, it's going to feel like a mild to a moderate sunburn. So you're going to feel the little bit of warmth, the tightness. They could possibly have a little bit of flaking, just really almost like sensitivity that they will experience, a little bit of flushed pink areas, in some cases worse than others, in some cases not as bad as others. Of course, that just is really going to depend on the skin type and that specific person. But so for me, I feel like the most important part is hydration, and then also making sure the area is properly cleansed and taken care of since that epidermis was broken. So you can totally expect to utilize our copper HA mist over the first 1 to 3 days for sure. We even say that a client can spray the area that was treated every 2 to 3 hours for the next 2 to 3 days. So if you think about that, that is pretty frequently, but it gives you immediate relief. It's almost like a cooling, calming, refreshing sensation. So if you think about how you feel with a moderate sunburn, you want that feeling of relief. So our copper HA mist is fabulous for that. The HA is going to hydrate the skin, but in a way to where you don't feel very heavy or weighed down, since it is in a mist form. And then the copper peptides and components in that aspect are really going to make sure decreased inflammation. So it's going to help promote the healing process, kind of speed up, accelerate the healing process, help with any pinkness or redness your client may experience. And again, the warmth and sensitive sensation that they may feel. Also, the copper peptides do help aid in a antifungal, antibacterial purpose. So again, just making sure the area is very cleansed and sanitized and you don't have any risk of adverse reaction. Also for cleansing, physically cleansing the face, you do want to use something very gentle, very mild. I love our hydrating gel cleanser. Since it is a gel, I feel like it really helps to clean out the pores and penetrate a little bit better as far as making sure dirt and debris, yes, are out of, the treated area. But also it has aloe, chamomile, green tea. So just an array of calming botanicals that will really help counteract the sensitivity your patient is feeling and experiencing, so they can get a good thorough cleanse, but in a gentle way. So utilizing the hydrating cleanser, the copper HA mist for hydration and relief. And then also after the 24-hour mark, you do want to make sure they have a good SPF. So day 2, SPF all over the treated area. Another product they could intertwine with all of this in those first 3 days is our HA serum. So just our pure hyaluronic acid serum that is great for hydration and kind of moisturizing the area, so that way they don't feel as tight and dry and flaky and all that good stuff. So those, in my opinion, are the best route to take as far as products and how to take care of the face. And then whatever else you would like to add to that too, Alex. I know there's a lot that you can kind of say for post-care.
Yeah, there really is. And the great thing too is when you guys do purchase a pen packet get depending which type of training you purchase, you're getting either an in-person training or Zoom training. Those are both your device training, and then a full-blown training with me on skincare where we go over all of this. Great of this video, but as Sydney said, if your patient doesn't have a good cleanser at home, you need to read them much. But hopefully they already have a great cleanser, or they've already purchased our hydrating cleanser from you. But make sure that they have that. Make sure they have their nice physical block sunscreen to use the next day. Of course, they can buy MDPens. Every single patient has got to go home with an please add it in there, include it in your pricing. This is going to be their best friend, especially that first day, as Sydney said, hands-free every 2 to 3 hours. Don't have to hold your hand over your eyes, nothing. Close your eyes, close your mouth, mist yourself down. Continue. And then, yes, I would definitely retail them one of our 3 serums to use. It could be the HA, it could be the Tighten and Lift, or the Cellular Renewal. We go over this during training, how you can kind of decide which serum would be best for your patient based on their skincare needs. All our invest in a growth factor gel, sell it to them. This is going to be great for them on those open microneedling, so they can either purchase it in the 3.4 ounce or the 1 ounce size. And that would be everything. SPF, serum, growth factor gel. And of course, we all love the Revita peptide. So if you love it as much as we do, you can resume that day 2 following treatment. It is our cream-based day and night cream, Revita peptide. So that can be resumed the following day. So you could just miss the first day. If you love Revita, use that the next day. Perfect. I do see some more questions in here. Thank you guys so much. The one, how do you move? Wipe it off or cleanse with the cleanser?
I'm sorry, Alex, you cut out just a little bit.
Oh, I'm sorry. Okay, so someone did ask how to remove the numbing cream.
Oh, okay, yes. That is a good question, because I feel like it's extremely vital to make sure you have whatever area you are treating thoroughly cleansed prior to actually penetrating that epidermis. So I like to take like a gauze or some sort of padding and actually wipe off the excess numbing if there is some still visible on the surface of the skin. This will vary, especially depending on the numbing and the skin type. Sometimes I will numb someone for 20 to 30 minutes and I'll still see residue topically. Sometimes I numb someone for 20 to 30 minutes and it's soaked all through their skin, so there's not much topically, maybe like a greasy, like shine almost. But regardless, either way, I try to take a 4x4 gauze and just thoroughly remove the topical excess. And then I go in with a double cleanse. I do utilize our hydrating cleanser. And then after that, I do try to use like an antiseptic, an alcohol pad, anything to really degrease the area. And then that is when I'm applying my copper HA mist, desired serum, and moving forward with the treatment. So just making sure you really get all signs or residue of that numbing agent off the area and off the skin before actually treating. So yes, I think that is my best way and my go-to of removing numbing.
Completely agree. Cleanse, alcohol, mist. And your cleansing style can, be a 4x4, like Sydney said. Maybe you use the cosmetic round sponges in your practice. Obviously, make sure you're throwing them away or one-time use. But yeah, however you intend to clean the face, it needs to be a full-blown cleanse to take off the numbing. So yeah, no makeup wipes, nothing like that. The next question was, can we mix HA, cellular renewal, and growth factor for the needle treatment and use growth factor at the end of the treatment?
I actually really love to do that. I call it like almost my little cocktail. So I will mix and utilize our HA 1 to 1.5 pump of the human derived growth factor gel, and then even a couple pumps, 2 to 3 of the cellular renewal. And my idea behind that is kind of for my more mature clientele that really want to see a difference in wrinkle reduction, loss of elasticity, fine lines. So just some major textural issues that they may be experiencing, signs of aging that they really want to decrease and diminish. I feel like those three are great together, in my opinion. I think they work really well together. I think the consistency once you combine them is really nice too. And then I always say, if you're going to use growth factor during your treatment, always end it with your treatment as well. You might as well. So doing a thin layer of that human derived growth factor after you have sprayed the area with the copper mist, completing your treatment, and then adding the growth factor at the end. I think that's a fabulous treatment. What is your take, Alex?
I heard about this from you, and I really hadn't been doing it. I had always saved my growth factor as if it was like PRP and used it at the end of the treatment. And recently I've tried that, and I really do like it. It would be a great way to upsell if you're not doing that on every single patient. So I would keep that in mind. I would try to include the growth factor gel at the end of the treatment for everyone as a general rule, whether you're upselling it or not. But yeah, in instances where you think it could benefit the patient, I loved it. You just have to make sure you do, loosen it up a little bit with one of the serums because it could be too thick and clog the cartridge. Mm-hmm. So I think it's important just to remember, of course, to be mixing it. But yeah, I loved it. I think it's great. We've got quite a few questions. This is awesome. Yeah. Can I keep the same needle head I used with my patient and use it again on their next session?
I do not recommend that. And there's a couple reasons. It's just extremely hard to thoroughly cleanse a needle cartridge. There's really no way for us to know if it is fully sanitized, and you just kind of run that risk of bacterial growth over that duration of time that they're not seeing you, and then they come back. So rule of thumb, and if there are different areas they want to hit or treat, I just try to do that in their session. If they want a full face, but then they have a little scar on their arm or they want to hit the back of their hands or take it to their neck, I just try to really give a thorough treatment during that session and explain to them, like, the needle cartridge is a one-time use. So we are going to utilize it during this session today, but moving forward, it will be discarded of and then utilizing a brand new one, packaged one, for their next session.
Yep. Short answer is nope. One time, single use, like Sydney said, it's not going to go dull. Even if you're treating a large area of stretch marks, it's not going to be like dermaplaning where you might need to open a second blade. That cartridge is going to, take you through face, neck, chest, whatever else. But no, you cannot clean it. You cannot keep it. So always a new needle. Make sure you're including that in your cost and expecting to do so. Barbara's asking, what would be a good cocktail to do for clients working on hyperpigmentation?
I do like that. So of course the HA, because that's just our basic guide to just the lubrication as a whole. I feel like the cellular renewal would do really well with hyperpigmentation. It does kind of help aid in that regeneration of the skin cells. So I think that you could see a good difference over time with incorporating that as well. What do you think as far
Yeah,
as?
you really can't go wrong. Honestly, the biggest thing with hyperpigmentation is going to be that they're suppressing that pigment
Mm-hmm.
in between treatments.
Mm-hmm.
So, but I really like Tighten and Lift, I would say, probably because of the little bit of lactic acid and the green tea.
Mm-hmm.
But you could totally mix cellular with Tighten and Lift, especially if they have a compromised skin barrier, which many people with hyperpigmentation do. So you could definitely utilize those two. If the person has combination or oily skin, I think that would be great because those two serums are pretty light.
Mm-hmm.
So utilizing that. But yeah, I usually do the Tighten and Lift when there's some pigment involved. It's not going to, get rid of the pigment per se during the treatment. But like I said, make sure they're suppressing the pigment in between treatments. Is stamping method better for hair restoration? The general answer is going to be yes,
Yeah.
Malkel. In instances where the hair is gone, like a receding hairline where there's no visible active hair follicles, longer than 1/4 inch, yes, you can trace in those areas. When you can see new hair coming in or active hair follicles, we recommend stamping. We'll be doing more on hair restoration here in the very near future too, going over that, but we do have a lot of content on it already if you do go in and look for it. Let's see, what skin ingredients, treatments should be avoided prior to getting microneedling?
So I would say any actives. So your retinols, retin-A's, retinoid products, anything prescribed by a dermatologist that's going to sensitize the skin and make you a little bit more vulnerable. I just have a 7-day rule. I feel like it's the easiest, 1 week and 1 week. So 7 days prior to treatment, stay clear of your active ingredients, and then 7 days after. I feel like it's the easiest to remember. But yes, anything that's going to sensitize the skin.
Yeah, I completely agree. It looks like the question's aimed to prior to getting microneedling. I'll just touch on it quickly. This is a long-winded answer, and these are all things that are included in training guides, which is great. Injectables, 2 weeks out from neurotoxins, at least 2 weeks out for filler. I would definitely go based on what your MD prefers. They may even want to wait a month with filler. But 2-week minimum. I agree with Sydney. The 1 week rule is safe, whether it's a retin-A, retinol, retinoid, retinaldehyde. 1 week before, 1 week after. And again, any of those alpha hydroxy acids, and any prescription topical acne medications and whatnot, any type of heavy exfoliations. But again, yes, it's a long answer, but we do answer all of that during a training. What is your personal opinion on dermaplaning and microneedling together?
I like it in certain cases. I do think it depends on the skin type and what is needed, and what is tolerated at that point. But I do like the idea of removing those topical layers in a different format and in a different way, and then going in with your microneedling. But again, I think that would definitely depend on that specific skin type and if that's tolerable for that person.
Yeah, I agree completely. If you are concerned that there could be sensitivity, you can have them come in at the 2-week mark in between their series. So if they're doing their treatments every 30 days, have them come 2 weeks out from their microneedling for a dermaplane. If you're just starting their microneedling series, do a dermaplane at the time of the facial done 1 to 2 weeks prior to their initial series. You can do that. One thing I will say, if you're dermaplaning right before microneedling treatments, you do, have the risk of a lot of irritation coming from the numbing, which would definitely happen on me. My skin would be a hot mess. So again, like Sydney said, it really depends on the patient, and then how much time you have. Do you want your treatments to run longer than an hour? Do you want to include that? But the safe way would be dermaplaning 1 to 2 weeks prior, or 2 weeks, in between the series mark. But we are both huge fans of dermaplane for sure. I saw one more question we can answer pretty quickly: the difference between the Refine and the Restore cartridges.
Yeah. So Restore is going to be your traditional microneedling. Those are the needles that are actually penetrating that outer layer, creating those microchannels, and breaking the epidermis, forcing the skin cells to renew and regrow. So it's going to be a more intense, more aggressive treatment, especially for textural issues. Our Refine is going to be little tiny needles all put super closely together. So it's not actually going to break the epidermis. It's almost going to cause like a stimulation. It's also great for plumping and adding HA, so hyaluronic acid, and kind of infusing that into the topical top layer of the skin. So it's going to help minimize signs of fine lines. It's also going, like I mentioned, going to help plump out certain areas. So under the eyes is a great area that I see a difference is around the mouth, the lips. It's almost like a refresher and just like a rejuvenation. So I like to sell these as a kind of like something to get ready for a special event or a special occasion or a wedding. A lot of my brides do the Refine needle. Vacation it's great for, and also anyone that has dry skin. So it's going to really help increase their hydration and moisture retention.
Yeah, your typical cartridge, that's your collagen induction therapy, classic microneedling, our 6 needles, depth of 0.5 millimeters, no numbing, just like Sydney said, plumps and hydrates. And half the face first, kind of standing back, you can really see drawing up hydration, especially on those dry, because you have a lot more choices with what you're needling into the skin. So in some cases, you can even bring out enzymes and other things such as that. Great for red carpet events, great for weddings, great for someone who's nervous about typical microneedling. Cost is going to be the same on your end, so make sure you're not, down, undercharging or anything like that. But it's a great treatment. You can combine it with other treatments. You can also open a nano or Refine needle at the time of a regular microneedling treatment and target those areas like Sydney said. So get in with the lips, closer to the eyes, things that you couldn't necessarily have done with that Restore needle. So awesome questions, guys. Thank you so much for tuning in today. I think we got to pretty much all of them. We love all your participation. This is our first time going live to all these platform venues at once. Thank you so much, Sydney, for being able to do this with me.
Yes.
And if you guys have any suggested things, you'd love for us to talk about in the future, we'd love to know. And reach out to MDPen if you are interested in virtual training, skincare training, microneedling device training. It's going to be www.mdpen.co. And we will see you guys soon. Bye.
Thank you.